Hello, my name is Christina Bacon. I'm a student family nurse practitioner here to do a head to toe assessment. Can you tell me your name
Raylan Bacon.
and your date of birth?
February 18th, 2006.
All right. We are at this point. I'm just checking her general appearance, making sure she looks well nourished, clean, her hygiene that looks good, making sure she doesn't look like she's in any distress, having any trouble breathing, anything like that. Do you know what today's date is, everyone?
February 12th, 2026.
Perfect. And do you know where you are?
Hartford City, Indiana.
And do you know who the president is?
Joe Biden.
Perfect. So she is alert and oriented ×3. So starting the head to toe assessment, I'm just looking at her overall appearance to begin with, her head, making sure it's normal. She doesn't have any tremors, no masses, no lumps that are protruding. I can palpate her scalp, make sure that I don't feel any lumps or any masses. Do you feel any tenderness when I push? So that's good. Moving on down to her eyes, I'm just looking for symmetric to her eyes, her nose, ears, mouth, making sure there's no drooping, no drainage, nothing like that. So her eyes, her sclera is white, everything looks clear, she has no drainage. We can do the exam, the Perla exam, to make sure her pupils are reacting like they should. So Raylan, I'm going to ask you to look straight, and I'm going to shine this light into your eyes. Good. Good. And look at my finger. Good. So her pupils are equal, reactive, round to light and accommodation. And at this point we can go ahead and do the fundoscopic exam. We're looking for the red reflex, the optic disc margins, things like that. This room is pretty bright, so I will likely just pretend, because when I tried this earlier I couldn't see, but I don't really have a whole lot of dark rooms in my house. But when I start, I want to make sure I am able to focus it first. And then starting at Braylon, I want you to look straight. And we're going to get close. And again, we're looking for the red reflex that's intact. Again, looking for the optic disc. And you'll note that you're there when you see the yellow creamy color, and the blood vessels that branch away. And you would do this bilaterally. Moving to her ears, because her eyes seem healthy. Again, no concerns there. Vision's 20/20, no drainage. Moving to her ears, I will inspect the external auricular. I will palpate the lobes as well as palpate the auricular, the tragus, make sure there's no masses, lumps, tenderness, make sure there's no drainage or obstruction outwards, which I don't see any. And then we can do the otoscope exam as well. And I'm just switching out my head. It's difficult to switch out. If you had any ear pain recently, perfect. So just pulling the ear back, just gonna look in. So the canal does have some cerumen present. I'm looking for the tympanic membrane, which I can find. It is pearly gray, no perforation. But she does, like I said, have some cerumen that could cause some obstruction if that doesn't get taken care of. And we will do this exam bilaterally. Some cerumen present in this ear as well. I cannot see the tympanic membrane in that ear due to cerumen blockage. So at that point, I could clean out her ears to get it all the blockage out. We're going to look at the patency of her nares. Her nose is symmetric. She doesn't have any drainage. I'm going to look up her nose. I don't see any blockage there. No issues breathing, trouble smelling. That is cranial nerve number 1, so that is good. Checking her eyes is cranial nerve number 2 with no error or issues. That's optic cranial nerve number 2. I am going to ask you to open your mouth. We're looking at your oral mucosa. I'm just showing my light in. Her hard palate is dome. I'm going to ask you to raise your tongue, say ah. Soft palate is good. Teeth are clean, hygiene, yellow, or mucosa is pink, moist. Go ahead and relax your tongue. Stick your tongue out, say ah. Uvula is midline. Throat, I don't know any exudate. She does have tonsils, I would say grade 1. No sore throats, anything like that. So I don't have any issues there either. Moving on down to her neck. I'm just palpating, making sure her trachea is midline, which it is. And I'm also feeling her thyroid gland, making sure I don't know any enlarged masses or it's irregular. So I'm going to ask the patient to swallow. Good, and it feels fine. At this point, you would palpate for lymph nodes. We got the pre-auricular and post-auricular lymph nodes, the occipital lymph nodes, superficial and deep chains, the posterior cervical, okay, walking, and the supraclavicular. And I don't feel any swollen lymph nodes. Moving down to her respiratory, I'm going to listen to her lung sounds. Actually, hold that. I'm going to palpate her carotid pulse. And we'll do this on both sides. Good. Good. And now we are going to auscultate for any bruits, and we'll do this with the bell of our stethoscope. So Bray, I'm going to ask you to turn your head over your right shoulder. Take a deep breath and hold it. Good. And turn your head to your left shoulder. Again, take a deep breath and hold it. Good. And no bruits noted. So at this point, I will move on down to her respiratory, making sure her lungs are clear, no issues noted there. And at this point, I just need you to breathe regularly. Good, and we're going to move on to her back. Go ahead and take a deep breath in for me and let it out. Deep breath in, let it out. Again. 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 One more time. Good. So all lung fields are clear. I don't have any concerns for any infections, inflammation, anything like that. I am going to percuss and look for any CVA. Do you feel any tenderness as I palpate through here?
No.
So that is good. Listening for cardiac sounds, listening for any thrills, pericardium thrills, things like that as well. So I'm going to listen to your heart, if that's okay, Bray. You'll want to do this with your diaphragm and your bell. For the sake of the video, I'm only going to use my diaphragm. So we're listening to the aorta. The pulmonic. The herbs. Tricuspid. And then the mitral. All of those locations are, I can hear the S1, S2, no sounds of murmurs, or I don't know any murmurs, gallops, rubs, so her heart sounds, all sound clear, good, no concerns. I can also feel for the apical impulse. In children, you will do the fourth intercostal space, adults would be the fifth. Typically closer to the nipple portion or nipple region. And that all feels steady as well. I will move on down to her other pulses as well. I'm going to check her radial, brachial, popliteal, pedal, and tibialis. So radial, and that one's strong. You can feel that one as well. 2+, brachial. Strong. Again, strong 2+. Popliteal behind the kneecap. Move you back. Moving your back. Okay. Popliteal behind, relax. This one's behind the kneecap. Strong 2+. Strong 2+. We're gonna relax. Dorsal pedis on top of the foot. Strong 2+. Posterior tibialis, pulse. Strong 2+. Moving to the other side, dorsal pedis. Strong 2+, and then again, posterior tibialis. Strong 2+. While I'm down here, I can look and inspect her feet, her overall circulation, make sure she doesn't have any lesions. I'm checking in between her toes, cap refill, looking for any edema, scarring that may cause concern, varicose veins, which I don't know any on her, so I don't have any issues or concerns that would cause any issues. Looking at her general integumentary system, she does have some lesions noted right here. They are round. They're more like warty lesions. Let me scooch up so they can see them. They're flesh in color. Their borders are discreet. I would probably just most likely refer her to a dermatologist. I don't think there's any issues going on. Don't cause any concerns. Next thing we're going to do is to percuss, or not percuss, we're going to listen to her arteries. So we'll listen to the aorta, the renal, and the iliac. We would listen to the femoral on most patients, but for this video, typically the femoral artery is in this area. Obviously I won't do that on video. Again, you'll do it with the bell of your stethoscope. Aorta. Left renal. Right renal. Moving on down to the right iliac artery and the left iliac artery. Or trying to hear any bruise, which I don't know any. While I'm down here, we're looking at the abdomen. Hers is non-distended for a child. I don't see any concerns. It's symmetric in shape. She doesn't really have any abnormal protrusions. I'm going to listen for her bowel sounds in all 4 quadrants. We'll do the diaphragm of our stethoscope. And hers are normal, active in all 4 quadrants. At this point, we'll palpate the abdomen as well as the liver and spleen for any abnormalities, looking for if we can feel any masses or enlargement that could cause concerns. Do you feel any tenderness at this point? I don't feel any either. It's soft, non-tender. Palpating for the spleen to see if, or the liver to see if we can feel any of the edges for liver enlargement, which I do not. And just see if I can feel the edge of the spleen, which again I do not, and again soft, non-tender. At this point I will check her deep tendon reflexes. We will start with her radius reflex, or her radial reflex. I'm going to take my stethoscope off. Start with your radial. Okay. And then we're moving up to her brachial. Just relax your arm as I hold it. And moving on. Go ahead and relax it. And this is her trapezius. Moving to her popliteal. Relax your legs. Relax. Relax. And then her Achilles. Now I'm going to note those at a 4 out of 4. We are looking at, now we're going to move on to her grip strength. I will have her squeeze my 2 fingers to note her strength. So that is good. I don't have any concerns there. Looking at her upper and lower body strength, I'm going to ask you to push my hands, pull my hands. Good. Push, pull, your legs back. Good. So I don't know any concerns with her upper and body strength. I would rate it as a 5 out of 5. We're going to ask the patient to walk so we can take a look at her gait. Again, I don't know any concerns there. While standing, we're going to do the Romberg's test on her to see if there's any neurological deficit. With something that can catch the patient if they start to fall. You'll want it near them. We'll ask the patient to stand, hold their arms straight out in front of them, and close their eyes. A normal sway is fine, but most patients that have a neurological issue that is going on will lose their balance and fall. Typically, they'll hold it for a little bit. This patient doesn't seem to have an issue, so we'll have her just take a seat. Next, I believe we'll move just to the cranial nerves. I went over a few of them. Go ahead and scoot in so I can go over them. So cranial nerve number 1 was the olfactory nerve, plugging each nerve, running through peppermint and citrus scents to make sure they are intact. Cranial nerve number 2 is the optic nerve, so doing the fundoscopic exam to make sure it's intact. Cranial nerve number 3, 4, and 6, the ocular motor, trochlear, and abducens, checks the extraocular eye movements. So just having the patient follow your finger with their eyes. So I'm going to have you follow my finger. So we can see that all of hers are intact. Cranial nerve number 5 is the trigeminal nerve, and that's testing like the like jaw muscles, the sensation on their cheeks, forehead, things like that. So go ahead and clench your jaw for me. And I can see the strength, or feel the strength in her jaw muscles. Having the patient close their eyes. Close your eyes for me. And using like a soft Q-tip. Can you feel that? So you know that the trigeminal cranial nerve number 5 is intact. Cranial nerve number 7 is the facial. You're looking at the symmetry of her facial features. So the smile, having her smile, making sure there's no droopingness, puffing out her cheeks, making sure one side's not drooping. Hers are all fine. Cranial nerve number 8 is the acoustic. So the hearing. You can test that by just using your fingers, making sure they can hear it. Also using the tuning forks for the Rhines test, the Weber's test, for the air conduction and bone conduction. Cranial nerve number 9 and 10, the hypoglossal and the vagus or valgus, is the gag reflex and the having the patient say "ah." So most of the time you could use a tongue blade, and most of the time that will trigger the gag reflex for this video. I don't have a tongue blade, but have the patient say "ah." Making sure their uvula rises and falls, stays midline. Her cranial nerves 9 and 10 stay intact. This is my daughter, so I do know that her gag reflex is intact. Smells trigger her gag reflex very much. Cranial nerve number 11 is the spinal accessory nerve. Having the patient shrug their shoulder as you apply pressure or weight. Go ahead and shrug up and down. Have the patient push or turn their head towards your cheek or your hand. And again to the other side. and you can feel that they're pushing that weight against. You know those spinal accessory muscles are working for cranial nerve number 11. That's a way to find out if their range of motion is intact as well. And last but not least is the cranial nerve number 12. That's the hypoglossal. That's just checking the tongue. So having the patient stick their tongue out, making sure it's staying midline, putting their tongue to their cheek, and pushing your finger just to make sure it is or the strength of their tongue. One thing I forgot to do when I was up by the nails or nares that you want to do is when you're doing your assessment is check their sinuses. So like the frontal up here, the ethmoid, and the maxial, to see if they have any sinus pressure or anything like that. I believe that concludes our video. But thank you, Bernlyn, again, for doing this video.